You're watching Talk with Audrey. Welcome back. Immunizations aren't just for children going back to school. Healthy older adults, especially those with complex or chronic health conditions, should make immunizations part of their preventive care routine to protect their health. My guest today is Dr. Paul Mikelecky. He's the Chief Medical Officer of Carelon Health. We're going to talk today about the importance of preventative care and what we need to know about this year's flu season and those new COVID variants. Good morning.
Good morning, Audrey. Thank you for having me this morning.
It's my absolute pleasure. So, I can't believe it's that time of the year already. Why is it important that people get their flu shots? And of course, do we need one every single year?
That's a great question, Audrey. And the flu is very contagious. And even if you have a strong immune system, you never know how the flu is going to impact you. Even if you have a good immune response, the flu virus can lead to days of work lost as well as school days lost. But even more importantly, in our more vulnerable patients or more vulnerable family members or friends, it can lead to more serious complications such as pneumonia and worsening of underlying medical conditions that can result in hospitalizations and even death. Subsequently, we want to get a yearly vaccine because the latest vaccines will have the different strains or the latest up-to-date strains to help our body's immune system rev up and protect against the latest viruses that are out there. So a yearly vaccine is the best way to protect not only ourselves, but also our friends and family and community around us.
So it's important, especially if someone has a chronic illness, that they get that flu vaccine.
You are correct. The flu does mutate, and there are different strains that come out. The CDC, or the Centers for Disease Control and Prevention, are continually monitoring, informing the different vaccine manufacturers the latest strain. Subsequently, the vaccines that you receive every year are going to have the best up-to-date information that allows us to protect ourselves and our loved ones against the latest flu strains.
So let me ask another question that I'm sure everybody's probably wondering about. Can the flu shot cause the flu?
It cannot. The flu vaccine is not a live virus. However, you may experience some of your body's immune response to the vaccine, and that can include fevers, some muscle aches, some joint aches, headache, nausea. These are typically self-limited over the course of a day or two, and oftentimes better with over-the-counter medications like Tylenol or ibuprofen, but you cannot contract the flu from the virus or from the vaccine.
How can you tell the difference between the flu and COVID?
That can be tough because they both cause fever as well as some of the general muscle aches and body aches that are common with viruses. Oftentimes, the best thing to do is get tested by your clinician's office for the flu or for COVID. There are self-testing kits, and even with the different strains of COVID, the COVID testing as well as treatments are equally efficacious. So they do work. However, we want to protect others around you. So if you do go into your physician's office, we recommend wearing a mask going into the office to protect those in the office while you get evaluated and treated.
And for those people who are also getting a COVID vaccine, is it safe to get the flu and the COVID vaccine at the same time?
It is. Looking into this, the Department of Health and Human Services did find that there were no safety concerns when receiving both vaccines. And we all know that schedules can be busy. So if you have the chance to get both, we recommend doing both at the same time.
Well, when is the best time to get the flu vaccine?
We do recommend it early in order to provide the best protection. I think we're seeing increased COVID cases coming out as people are going back to school and as people are working back in the office and coming together after the summer. We are anticipating the flu vaccine to come out in the next week or two. And similarly with the COVID vaccine, the latest up to date in the next, I think within the next month, probably the next couple of weeks. So kind of keeping track on that, and would recommend reaching out to your clinician's office to see when they're getting that in. But the sooner we can protect ourselves and our loved ones, the better.
I hear that. We do not want a repeat of COVID or bad cases of the flu. So guys, what we want you to do is stay healthy. And as always, check with your healthcare provider. My guest has been Dr. Paul Mikelecky. He's the Chief Medical Officer of Carelon Health. We've been talking about the importance of preventative care and, of course, information about this year's flu season and those new COVID variants. Dr. Mikelecky, thank you so much for joining me.
My pleasure, Audrey. Thank you for having me. And for additional information, patients or your audience can go out to caremore.com/flu, where we have more up-to-date information available.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll see you next week.